henceforth we'll continue on. The first things we'll look at the viral illnesses, and among the viral illnesses we have something called as viral exanthems. Now what is an exanthem? Exanthem is an eruptive lesion that is seen with viral diseases. Now these eruptions are generally of infectious in origin, predominantly viral, but many a times various drug reactions can also cause exanthem like manifestation. Moving on, if we look at the all the viruses which cause exanthemus disease, we have these are the viruses. What are the viruses? Among the herpes group, we have the herpes simplex 1 and 2, varicella zoster virus, the virus which causes chickenpox, Epstein virus, human herpes virus 6 predominantly, and then we have some of the DNA viruses which include pox virus, parvovirus, and human papilloma virus. Okay, so and in the RNA viruses, I think you have already heard about these diseases: measles, rubella, and another virus called as Coxsackie viruses. Now, if you look at the herpes viruses, the herpes virus, they have a certain characteristic. The first characteristic is that they can establish a latent infection. That means once a person gets infected, the virus remains in the body, and whenever the immune status of the patient decreases, this virus can reactivate. This kind of infection is called as latent infection. Now, among the herpes viridae, we have three groups of viruses: that the alpha, beta, and gamma. In the alpha subfamily, we have human herpes virus 1, 2, and 3, obviously commonly known as HSV 1, 2, and varicella zoster virus. In the subfamily beta group, we have three viruses, that is human herpes virus 5, or also called as cytomegalovirus, commonly called, or we have human herpes virus 6 and 7, which are called as roseola virus. And finally, we have the subfamily gamma, which have human herpes virus 4 and 8. If you look at the common names, human herpes virus 4 is more commonly known as Epstein-Barr virus, and human herpes virus 8 is now called as Kaposi sarcoma associated human herpes virus. It is implicated as a causative agent of Kaposi sarcoma. Okay. Now let us look at the important infections first. We'll look at herpes simplex virus. Now, as the name suggests, why simplex? Because this infection does not cause severe disease. Hence, it was named as herpes simplex. But herpes simplex virus can also cause severe disease. The most predominant one is herpes simplex virus encephalitis. Most of the manifestation is cutaneous manifestation. Both the viruses, they can reactivate and they undergo latency in the nerve cells. Hence, on reactivation, they will affect specific dermatome on the body. What is a dermatome? Dermatome is a specific part of the skin which is supplied by a particular nerve. Okay, so if that nerve or the ganglion of that nerve is affected, the lesions will appear in that particular area of the skin. Now, if we do compare both the herpes simplex 1 and 2, the first thing is that we can see herpes simplex virus 1 is more commonly seen in children and also in adults, and the route of spread is predominantly through mucosal secretion, that is the oral mucosal secretion, and in case of children it is the saliva. And in case of herpes simplex virus 2, although the spread is through the mucosal secretion, but this route is more commonly genitourinary. Hence, HSV2 is more commonly associated as a sexually transmitted disease. Furthermore, there is a preferred area of distribution, that is HSV2 commonly affects below the belt, that means below the abdomen, whereas simplex virus 1 predominantly affects above abdomen. However, this is not a rule, it's a consensus. That means commonly it is seen, but it is not a rule. We do encounter HSV infection anywhere in the body. Now, if you look at the differences again, you can see the age that affected. HSV1 commonly affects children more, spread among the children more commonly, whereas I have already told you HSV is more commonly associated with the sexual route of transmission. Hence, the transmission is more commonly seen in adults, especially young adults. Furthermore, if we look at the common manifestations in HSV1, we can find orophageal mucosal lesions and encephalitis and meningitis. So, this is a very severe complication with HSV1. Many a times, children do present with signs of encephalitis or meningitis. Sometimes, on reactivation, if particular areas of the face, for example, near the eyes, these are affected, then these lesions can also appear in the ocular region. Now, as far as the neurovirulence is concerned, HSV1, the chances of or the virulence is much lesser as compared to HSV2. What does it means? Virulence মানে কি? Local damage is more commonly seen with herpes simplex virus 2 as compared to herpes simplex virus 1. And one more very important difference is that most of the herpetic infections can be treated with antiviral drugs, commonly acyclovir, ganciclovir, valganciclovir, or even foscarnet can be given for treatment of these conditions. However, it is seen that HSV2 becomes much more resistant to the antiviral drug as compared to HSV1. Okay, so this is what I have already told you. Transmission is mainly to the oropharyngeal contact for HSV1, and for HSV2 it is more commonly to the genitourinary secretions. Okay. Now, how does this reactivation occur? Suppose a person has already been infected with herpes simplex virus. That person will start producing antibodies, and that after the initial episode, the patient becomes disease free. However, this virus will survive and remain in the ganglionic cells. Whenever the patient gets another infection and the immune status of the patient decreases, this virus now reactivates. That means it comes out of its latency and multiplies. And now it will spread along the neuron, that is the axonal spread. And if this is a cutaneous nerve, the manifestation will be at the end of the nerves, that is that skin. And if it affects the ocular region, it can also affect the eyes, nose, rhinopharyngeal area. Interesting thing is that, especially with herpes simplex virus 2, this reactivation can go on prolonged. That means for a long period of time, the patient will have episodic reactivation time and time again. So every time the patient comes with reactivation, we have to treat the patient, but the patient is not able to clear the virus from the body. Keep in mind, the nervous system of the human body is one of the secluded, anatomically secluded areas. That means the immune cells cannot reach there. So whatever antibody is produced in the body will not be able to neutralize the virus, those which are already lodged within the ganglionic cells. Now the main incubation period is between 1 to 26 days, round about 7 days. Now this is important because I have already told you HSV2 is a sexually transmitted infection. So whenever a patient presents with any kind of a genital lesions resembling that of herpes, you have to track the sexual history in the last 2 weeks, because the incubation period is round about 1 week. So what are the common areas which are affected? In case of HSV1, the common areas that are affected are the oral area, buccal mucosa, and near the lips. Sometimes gingival stomatitis and pharyngitis can also be seen. Like this, if you can see, there are vesicular lesions, and these vesicular lesions can sometimes rupture and look like this, more or less in the perioral and the oral region. Furthermore, sometimes even ocular lesions can also happen and present like this. Some of the specific lesions are named after specific site. For example, herpetic whitlow. Herpetic whitlow is a typical herpetic lesion that is seen on the fingers. This was earlier seen when most of the medical practitioners were not using gloves for examination of the patient. So after the gynecologist did the vaginal examination without a gloved hand, this virus can infect the finger of the doctors and causing lesions on the tip of the fingers. That is called as herpetic whitlow. Similarly, these lesions can also spread by skin to skin contact. And this was seen in the ancient times when people used to wrestle. Almost most of the body was exposed during wrestling, and when there was skin to skin contact, this lesion used to spread from one wrestler to the other wrestler. This was called as herpetic gladiatorial. Similarly, other manifestations can be like that of eczema herpeticum, where the lesions resemble that of eczema or erythema multiforme. That means the lesions are no longer vesicular but more erythematous. Now, coming to some of the more significant consequences of a herpetic lesion. The first significant consequence is CNS infections. We already know they can remain in the latency in the ganglionic cells. However, primary or secondary infections of the herpes virus may also infect the central nervous system and may end up resulting in either meningitis or encephalitis. There are some predictions, like in a CT scan, in case of encephalitis, we can find uh, temporal regions of the brain may be affected, which more or less suggests that of herpetic encephalitis, but that is not uh, a pathognomic feature. But commonly it is seen. Furthermore, these herpetic lesions can also affect various parts of the eyes, including the cornea and the retinal nerves also. The previous picture which I showed you was where the skin over the eyes were affected. But ocular infection means the nerves supplying the eyes, that is the retinal nerve, trigeminal nerve, those when are affected, then we call it as ocular manifestation. Now, genital manifestation are part of the cutaneous manifestation, but always keep in mind genital regions are more pain sensitive, and these herpetic lesions are painful lesions. Hence, all the genital lesions will be very, very painful. The next part are visceral and disseminated herpes. Now, what is this? Now, suppose the patient was infected with the herpes virus and now the virus remains in the patient body, and because of some other illness or maybe an iatrogenic, for example, the patient may be given steroid therapy or chemotherapeutic medications may be given to the patient, and the patient has a very, very low immune status. At this point of time, we can see severe herpetic lesions all over the body. This is called as disseminated herpes infection. And sometimes these lesions can also be seen in all over the mucosal region, not only inside the mouth of the pharynx, but also inside the gastrointestinal tract, which can be observed through endoscopy or colonoscopy. That is called as visceral herpes. And finally, suppose if a pregnant mother is actively infected with herpes virus, and during the active infection she gives birth to the child. Now, this child does not have any antibody because the mother was not infected previously, and this child will now have a full blown herpetic infection. That is called as neonatal herpes. Understood? So, these are the various manifestations of herpes virus. Now, most of the time herpetic infections are diagnosed clinically. Laboratory confirmation is not required pretty much. However, you can go for laboratory confirmation of the diagnosis by sending the sample. What will be the sample? It will be the vesicular fluid of the lesions. The lesions that are seen on the skin, if you deroof the skin and take out the vesicular fluid and send it to the lab for something called as zinc smear. Now, what is this zinc smear? Basically, we take that fluid and stain with a Giemsa stain. And I think you have read about cytopathic effect. Have you read about cytopathic effect? No. Actually, what happens is that whenever a cell is infected with a virus, the virus interferes with the normal physiology of the cell, normal metabolism of the cell, both protein synthesis, enzyme synthesis, etc. and etc. Virus interferes with this normal mechanism of the cell, there is bound to be some changes in the cell. So these changes are present in all kind of viral infections, but not all can be seen under the microscope. In some viral infections, there are visible changes in the cell. In some cases, the cell may enlarge in size, or it may shrink in size, or be the nucleus of the cell increases much more as compared to the cell itself. It is called alteration of the nucleocytoplasmic ratio. Or we can find many kind of granules being present in the cell, either in the cytoplasm or in the nucleus. So these sort of changes which appear, these changes can be appreciated on microscopy. Hence, these are called as cytopathic effects. Okay. So even in herpes virus, we can observe cytopathic effect. Now, what is the cytopathic effect seen over here? If you can see, there are many cells, but over here, this cells is huge. Why it is huge? Because it is called as multinucleated giant cells. There are many nucleus which has coalesced together and the nucleus has divided, but the cell has not divided. That means it's a large cell with numerous nucleus. This is called as multinucleated giant cell. This can be easily observed with simple staining like Giemsa stain. So, if you are asked how can you confirm whether it's a herpetic lesion or not, you can deroof the lesion, take out the vesicular fluid from the lesion, stain with the Giemsa and observe under the microscope looking for the cytopathic effect. What will be the cytopathic effect? Multinucleated giant cells. Alternatively, you can also isolate the virus from the vesicular fluid and go for viral culture. Obviously, viral culture is more laborious and tedious. You can also go for detection of viral antigen and viral DNA itself with the help of molecular test. So these are the methods by which we can detect the virus. Nowadays, we can detect it more rapidly with the help of something called as indirect immunofluorescence. So what is indirect immunofluorescence? We use particular fluorescent dyes tagged with anti-herpes virus antibodies. And then when we take the tissue or the fluid from the sample, we allow the antibodies to react. Now, if the herpes virus is present, the antibodies will bind to the herpes virus, and the fluorescent dye is attached with the antibody. Then, when we observe it under the microscope, we can see the fluorescence of the chemical. As you can see in this picture, not all cells are fluorescent. Only some of the cells are bright green in color. That means these are the cells which are infected by herpes virus. So these are the way in which we can diagnose a case of herpes infection. As far as the treatment is concerned, I have told you the most commonly used drug is acyclovir. In serious infections, we can also give ganciclovir or valganciclovir or foscarnet, and cidofovir are usually reserved in case of drug resistance cases, which are more commonly seen with herpes simplex virus type 2. Okay. Now, how can we prevent this infection? First thing, we need to educate the people about the possibility of transmission through unprotected sexual intercourse. Hence, making people more and more aware of sexually transmitted diseases can prevent the spread of herpes simplex virus 2. Furthermore, we can also treat the patients as early as possible, because most of the time the disease actually spreads from the people. These are the carriers. That means they harbor the virus and shed from the various routes, either through the genitourinary route or through the oral saliva. So these patients must be treated. Now coming to the next virus, in the herpes virus, it's called as the Varicella zoster virus. And I hope most of you are aware about this virus. This virus causes what is called as chickenpox. That is a vesicular lesion. However, like herpes virus, this virus can also has a tendency to be latent inside the body and reactivate periodically. When the reactivation of the varicella zoster virus occurs, we call it as shingles or zoster. This is called as herpes zoster. Now, why I am telling you this? In your examinations, sometimes the question may be asked about varicella zoster, sometimes may be asked about herpes zoster. If it is asked varicella zoster, that means the examiner is asking you about chickenpox. And if he or she is asking about herpes zoster, that means he or she is asking about the reactivation of the virus. Don't get confused in between these two. Okay. So moving on, how does this infection is acquired? This infection is generally acquired through aerosol transmission. That means it is the route of infection is through the respiratory route. So whenever an infective patient sneezes or coughs, in every droplets he or she gives out this virus, and any person who comes in contact with this patient will get infected. Okay. So if you are asked that a patient X is infected with varicella, what advice you should give? That person should always wear a mask. That is the best method by which you can reduce the chances of transmission. Okay. So what happens there? When the person acquires the infection, the first site of infection is usually nose or the upper respiratory tract. From there, the virus gets inside the bloodstream and causes viremia. From there, it ends up in the skin, that is the nerve endings of the skin, and thereby causing lesions on the skin. Sometimes this virus can also end up in the central nervous system or the spinal nervous system, especially the ganglions where it undergoes latency. However, keep in mind it is not restricted only to the nerves and skin. Almost all internal organs may be affected. Most commonly, respiratory tract is affected. Hence, after the viral episode, secondary bacterial infection of the respiratory tract, that is secondary bacterial pneumonia, is very commonly seen. Other than that, any deep-seated organ including the liver, the spleen, even gonads like testes and ovaries can also get infected. However, it is generally seen that in cases of children, these organs are less affected. Whereas in case of adults, the chances of this organ damage, end organ damage, is much higher as the person ages. So chickenpox, if it happens in an adult or an elderly patient, the severity is much higher. Whereas in case of children, the severity is very low. So what is the incubation period over here? Incubation period is about 10 to 21 days. Again, why the incubation period is important? Because you need to know the contact history of the patient. Now, how does the rash comes up? The rash appears like a vesicular. Vesicle means fluid-filled lesions, and they are centripetal in distribution. Centripetal means more lesions are towards the center of the body. That means thorax and abdomen, much lesser on the periphery, that is the limbs. Next, these lesions are polymorphic. That means if you examine the patient, for example over here, you can see one lesion which is almost healing, one lesion which is appearing very recently, and one lesion which has appeared 1 or 2 days back. That means pleomorphic in appearance, at various stages. And they appear in crops. That means in some part of the body, multiple lesions will appear at one point of time. Then again, next day, another crop of lesions will appear. Another interesting feature in case of chickenpox is that, obviously, because of the viremia, the patient will have fever. But I have already told you, the skin lesions appear after the viremia. That means whenever the virus enters into the blood causing viremia, then from the blood it gets deposited on the skin and causing the lesions. So every time a new crop of lesions appear, there will be an antecedent history of fever. So if you are diligent enough to take the history from the patient, you will find out the patient will say every time there is a fever, there are new lesions which are appearing on the body. Okay. Now, There can be many complications, but the most common complication that is seen is secondary bacterial pneumonia. Why? Because like in case of skin, we can find these lesions appear, and these lesions, when they get denuded, the chances of infection are there. Similar lesions also appear in the respiratory tract, and when these open areas get colonized by any kind of bacteria, most commonly endogenous bacteria from the patient's own body, the patient may end up having bacterial pneumonia. This pneumonia is called as secondary bacterial pneumonia. Secondary means secondary to primary viral illness. That is the most common complication. So whenever a patient of varicella, if you do encounter a patient with varicella, initially the patient may have respiratory symptoms. That is because of the viral pneumonia. That is the first episode. Okay. After about 3 to 5 days, if the patient starts to having respiratory manifestation, maybe the cough has increased, or now the cough expectoration is coming out, or the fever is more, that is the rapid rise of fever or more frequent fever. If these things come up, that means you have to suspect the patient may have secondary bacterial pneumonia, and in this case scenario you have to give antibiotics. Whereas in the primary respiratory complaint in chickenpox, it is due to viral pneumonia. There antibiotics have got no role. Okay. Now extracutaneous complications may be CNS involvement, I've already told you, and organ involvement. Now next comes is pregnancy. Now this is an interesting feature. Now suppose if the woman has already had the disease before becoming pregnant, what will happen? She will produce antibodies, and those antibodies will be transmitted to the child during the period of gestation. So the child will be protected from the virus up to 6 months of age. Okay. But suppose if the patient, that the woman gets infected with varicella, that is chickenpox, during pregnancy, what will happen? See, if the woman is in the first trimester of pregnancy, chances are the fetus will get damaged, because this viremia can cause end organ damage. So if the mother is affected, the chances of fetal infections are high, and there might be end organ damage even in the child itself. However, if the infection occurs in the third trimester, where organogenesis has happened, the chances of it affecting the child becomes much lesser. Understood? But a curious case appears if the mother gets infected just before delivering the child. What will happen? Suppose you have delivered a child, and in the evening, when you go for the routine checkup, you find the mother has vesicular lesions all over the body. Now, when the rash appeared, prior to the rash, viremia will be there. That means the mother was already infected before giving the birth, and now she has already given the birth. That means the child is also infected, and by this time the mother has not at all produced antibodies, so the child also has no antibodies, but the child has the virus. So this is a very interesting phase. That means it is also called as neonatal varicella. Understood? Now suppose if the mother was affected about 3 weeks prior to giving birth, at that point of you even don't need to interfere. Why? Because by that time the mother has already produced antibodies, and most of the antibodies would have already been transferred to the child. But within that period, that means the mother has transmitted only the virus to the child. So in this case scenario, you have to treat the child, that is the neonate, and most importantly you have to give immunoglobulin to the child. That means artificial antibodies has to be given to the child. Have you understood? So varicella zoster in pregnancy is a very dubious scenario. So proper history is very important to delineate the timeline, and based on the timeline your intervention to the child has to be there. And I've already told you, if the mother is affected in the early part of the pregnancy, the fetus may get affected, and that is called as congenital varicella syndrome. Okay. Now, very important very important point that you have to know about chickenpox is that first things first, it's a highly contagious disease. Contagious means not only through droplet infection but also through aerosol. Now, when aerosol infection occurs, that means just limiting yourself to about 6 meters is not enough. That is 3 meters is not enough. Next, period of infectivity. This is very, very important. That is from 2 days before the onset of the rash to 5 days after the vesicles has clustered. Keep this in mind. So, how long any person is infected? That is 2 days before the person gets the rash and 5 days until the vesicles has clustered. That means almost healed. That is the timeline in which the person is infected. This is very important not only for the patient that you will be treating but also for your own self. Whenever, suppose you are in an outpatient department, a patient comes with a rash, the first thing you must ask, when did the rash appear? Okay, and whether the vesicles has clustered or not. If either of the answer lies during the infectivity period, that means you may also get infected. Similarly, whenever a patient, suppose your friend lives in the hostel and he says, my roommate has chickenpox, and asks for your advice. So, what can you do? Why? Next things are, humans are the only reservoir. That means if somebody has acquired the infection, he or she has acquired infection from any other human being, not from any other source. So proper isolation and infection control can limit the spread of the disease in any population. And next but most important part is, that is, there are no carriers. That means only acutely infective cases can spread the disease. Once the acute infection goes over, he or she is not infective. Hence, isolation of all patients during the period of infectivity is very, very important. What kind of isolation? কি কি আইসো ইনফেকশন কন্ট্রোলে পড়ানো হয়েছিল তো, কি কি প্রিকশন হয়? আরে এয়ারবোর্ন ভাইরাস তো, তাহলে কী হবে, কী প্রিকশন হবে? রেসপিরেটরি রুট অফ প্রিকশন আগে নিতে হবে, অ্যান্ড তার সঙ্গে কন্ট্যাক্ট প্রিকশন. ওয়াই? Because every time the person sneezes or coughs, he or she will have the virus on their hands. So contact precaution and respiratory precaution, those are very important. And the patient should be isolated from the social activities. It may be work, it may be school, it may be colleges, should be isolated so as to control the spread of the infection. Another very important part is, read the last line, that is the secondary attack rate. Secondary attack rate, do you have any idea what is secondary attack rate? It means, suppose there are 100 people over here and a person with acute in the phase of infectivity enters into this room. So 100 people are exposed. Now in case of varicella, about 70 to 90% of all people will be infected. Can you understand the implication? So if the person who you think is having chickenpox, if he or she is not socially isolated, he can spread the disease to so many cases. So this is called as secondary attack. Hence isolation is very, very important. Whether it's a child whether it's an adult, whoever the patient may be, has to be isolated. Okay. Now let us look at what is zoster or herpes zoster. Now zoster is the reactivation of varicella virus. So what happens is, after the initial phase of infection, the virus, after viremia, it lodges inside the various ganglionic cells. It's very commonly seen with the spinal ganglions, and there it remains in latent period. Whenever again the immune status of the patient decreases, it reactivates periodically, and commonly these spinal nerves which supply to specific dermatomes of the body, those will have herpetic lesions. This is called as herpes zoster. So always keep in mind three terminologies may look almost similar. One is herpes simplex, that is because of HSV 1 and 2. Next is varicella zoster, that is the chickenpox, and the reactivation of varicella zoster is called as zoster or herpes zoster. It is also called as shingles. Now look over here. Most commonly these lesions appear in the trunk, that is the chest and the abdomen, in specific dermatome. Sometimes it may also affect specific area in the hands and the legs. Like you can see, this particular area in the thigh is affected and crops of vesicles can be seen. Similarly, if you look at this patient, one part of the face is affected. Can you name which nerve is affected? Trigeminal. Trigeminal nerve has three sources. One is R. So the nerve. Now, if this part, the virus remains latent in this ganglion, this part may be affected, including the eyes, and only in this area, this dermatome, ট্রাইজেমিনাল নার্ভ গ্যাংলিয়নেরও একটা পার্টে এফেক্ট হতে পারে, ঠিক আছে? Similarly, segmental distribution can be seen, and again when it's come to diagnosis, most of the time it is diagnosed clinically, and again you can go for a laboratory diagnosis like herpes. You can go for the Zang smear, you can find multinucleated giant cells, you can also go for isolation of the viral DNA with a molecular method or antigen detection, and also go for immunofluorescence testing and viral culture. Like herpes, treatment is very commonly given with acyclovir commonly. Now early treatment with acyclovir not only reduces infectivity but also reduces the symptoms and manifestations. Hence treatment should be given to almost all patients. Just keep in mind, acyclovir has some renal effects, so any kind of patient with renal compromise, you have to give it very carefully, and also advise the patient to drink plenty of water so that the patient does not get dehydrated. Now like varicella zoster, in case of herpes zoster, that is reactivation. Now reactivation means the latent virus that was present in the ganglion has reactivated and started to multiply. So in this case scenario also you have to give antiviral drugs, that is acyclovir. And furthermore, because they are irritating the nerve endings, these lesions are very, very painful. So you have to give painkillers for those. Now coming to vaccine. Varicella is a vaccine preventable disease. The vaccine that is given is a live vaccine, and the vaccine is by Oka strain. It is given in the childhood, and it can also be given in the adults who are not vaccinated or who have not had the infection previously. But if a person gets infected, it is considered that the immunity that the person gains lasts almost a lifetime. But one very important advantage of this vaccine is that after the normal or natural infection, the antibodies produced are after 7 days. Okay. But after giving the vaccine, the antibodies can be produced as early as 3 to 4 days. This can be utilized. Suppose you have never had this viral infection in your lifetime, and now you have come in contact with a patient who is in the infective phase. That means you are infected. You have two options. Either you can wait and see whether you are having the disease or not, and when you have the disease, you can go for the antiviral therapy. This is what normally is advised, because if you are immune compromised, it's fine. But suppose if you can't take that risk, then we can advise you to take the varicella vaccine. Okay. Why? Because the virus has an incubation period is about 10 days. So before with the natural infection, the virus produces viremia. The vaccine will be able to produce the antibodies inside your body much quicker. Thereby, you can abort the infection. Infection. Okay. Now coming to the other herpes virus, Epstein-Barr virus, cytomegalovirus, they cause systemic infections, and along with which it can produce some systemic manifestations. Cutaneous manifestation can be seen with a particular virus called as human herpes virus 6, and in children it causes an exanthemus disease. That means fever with rashes all over the body. This is generally seen in children. It is also called as sixth disease. That is the 6th day of illness. Earlier, many diseases were classified as the first disease, second disease, third disease. Similarly, sixth disease. This is called as roseola infantum, and in slightly adult age group, it can cause infectious mononucleosis like Simplex. Next comes a virus called as parvovirus. It is notorious. This causes a disease in the childhood, which is called as the fifth disease, or erythrema infectiosum. As the name suggests, erythrema, that means reddish color lesions, and infectiosum means it can spread from one child to the other. Now, it also affects red blood cells, but what you can see in case of the appearance, the rashes appears like this. The child may have rashes all over the body, and predominant lesions can be seen in the facial region, especially in the cheeks. This appearance is also called as slap cheek appearance. Now, I have already told you it also affects the RBCs, that is the red blood corpuscles, because of which the child also may present with transient aplastic crisis or pure red cell aplasia. In pregnant women, infection with parvovirus may also lead to hydrops fetalis. Now, detection of this virus, again, most of the time, fifth disease is diagnosed clinically from the appearance of the rash. Definitive diagnosis can be done with the help of the molecular methods and antigen and antibody detections. Next type of virus which causes cutaneous lesion is called as human papilloma virus. HPV, I think you have already heard. This is more associated with sexually transmitted disease and cervical carcinoma. Now keep in mind, only some strains of the HPV can cause cervical carcinoma, but almost all other strains causes cutaneous manifestation. What are these cutaneous manifestations? These are called as common skin warts, and if these warts appear in the hard skin of the palms and soles, these called as palmar or plantar warts, and if these warts appear on the anogenital region, we call it as anogenital warts. So these are an example of plantar warts. Next comes another virus. Although this infection obviously in all probability you will not encounter in your lifetime, this is about smallpox. Have you heard about this disease, smallpox? তাহলে এটা বলো, ডিজিজটাকে স্মলপক্স বলা হয়, হোয়াট ইজ এ বিগার পক্স বলতে পারবে কেউ? এই ডিজিজটাকে বলা হয় স্মল পক্স। দেয়ার মাস্ট বি সামথিং বিগার পক্স, সেটা কোন ডিজিজ ছিল? চলো খুঁজে আনবে, তারপর বলবো। So basically, smallpox is caused by pox virus. Pox virus is the largest of the viruses. It is also an enveloped virus. যেগুলো ইম্পর্টেন্ট জিনিস সেগুলোই বলছি, আমি স্মলপক্সের ডেপথে যাচ্ছি না। There are two types of smallpox virus. One is called as the variola virus, which causes the disease, and another is called as the vaccina virus, from which the vaccine was developed. মনে রাখা সোজা, vaccine does not cause the disease. Variola causes variolous lesion, মানে পক্স লিজনটাকে variolous lesion বলে variolous lesion. But among the pox viruses, what lesions you will encounter is called as molluscum contagiosum. I'll come to it slightly later. Okay, first things first, smallpox was a very deadly disease, caused serious erythema, and had a mortality rate of almost 97%. But as a human population, human beings are able to eradicate the disease with the help of vaccine. But keep in mind, this virus, although eradicated naturally, this virus is still preserved in laboratories, both in Russia and United States. So there is something called as a chance of bioterrorism. Suppose if this virus leaks out from this laboratory and spreads, 100% of the human population today has got no immunity to smallpox. Now, as compared to the pre-eradication phase of the human population, smallpox used to happen every about 4 to 5 years. The people who used to survive every epidemic or pandemic, they were immune throughout their lifetime. So prior to eradication, a large percentage of the population were actually immune to smallpox. But today's generation, because smallpox was eradicated in 1980s, 100%, almost 100% of the population are susceptible to smallpox. And with a more high mortality rate of 97%, if this virus mutates or another virus mutates like that of smallpox, it can cause havoc in the human population. This is the reason why the virus is maintained in two selected laboratories, so as to we can produce vaccines if required. Now, a very common question that may be asked to you in your examinations is why this virus was eradicated, why it was possible for eradication. First things first is, this virus has got no animal reservoir. There are no carriers. That means the disease can be acquired only from cases. Secondly, once a person survives the infection, he or she remains immune to the virus lifetime. Next, vaccination provides almost 100% immunity. Thirdly, this viral disease is very easy to detect because the manifestation is cutaneous. Any kind of skin eruptions can be detected very easily as compared to other viral illnesses where cutaneous manifestation may not be seen. Secondly, subclinical disease were not, people who had subclinical disease were not able to transmit the disease. Subclinical means, what is subclinical? The virus is present within the body, but there is no manifestation. Now, this is the most problematic area. These people actually transmit more commonly. But in case of smallpox, subclinical disease patient did not transmit the disease. And finally, and very importantly, we have a very effective vaccine, and vaccination was implemented in a worldwide basis. That is a very important reason why this virus was eradicated. Again, another question may be asked, that is the differences between the rashes of smallpox and chickenpox. Obviously, you will never see a case of smallpox, hopefully in your lifetime, but still go and read this. So this is a picture where of smallpox. A very significant difference in case of smallpox and chickenpox is that I've already told you, in chickenpox we can see various crops of lesions at various phases. Some may be in the pre-eruptive phase, some in eruptive phase, some in vesicular phase, some in crustated phase. But in case of smallpox, all the lesions will be in the same phase, uniform. Okay, laboratory diagnosis again almost similar. I'm not going into this historical context of cowpox vaccine, how this vaccine arrived from cowpox, etc. What is more pertinent infection that happens today regarding pox virus is the disease called as molluscum contagiosum. মোলাস্কাম মানে কি বলতে পারবে? মোলাস্ক, মোলাস্ক দেখেছো তো, সি বিচে পাওয়া যায়. So the lesions appear like that. Secondly, contagiosum. Contagiosum means it spreads through skin to skin contact. So this infection is more commonly seen in children and adults who come in contact with the children. Which adults? Mothers and caregivers, school teachers, daycare center workers, pediatricians, they may get infected. Now lesions are like this. Now, these are very particular type of lesions. ভালো করে দেখলে I don't think you will forget. Eruptive lesions, and you can see a ভিতরটা কি, ভিতরে ঢুকে গেছে, এটাকে কি বলে? Umbilicated, almost resemble the umbilicus. ঠিক আছে, they are circular and has a dimple in the center. বললাম very easily transmitted. Now normally molluscum contagiosum is a self-limiting disease. However, if the patient is immune compromised, it can spread rapidly and can cause generalized and severe and persistent. Confirmation of diagnosis can be done with histopathological examination or by PCR. Okay, this is important. Pox viruses can be cultivated, but molluscum contagiosum virus cannot be cultivated. ঠিক আছে, এটা মাথায় রাখবে, পরীক্ষায় লেখার সময় তালে গলে এটাও ভাইরাল কালচার লিখে দেবে. ভাইরাল কালচার ইজ জেনারেলি ডান অন সেল কালচার. ঠিক আছে, সেল কালচার মানে হচ্ছে in some particular types of cells the virus can infect and survive, but that cell line has also need to survive for viral culture. This is not an artificial medium, these are cells, so these cells has also got to survive. The molluscum contagiosum cells generally affect the skin cells, so all the available cell lines which has skin cells, keratinocytes, molluscum contagiosum does not go in those cell lines. Maybe in the near future we can find some of the cell lines which may go the cell culture, but as of now it is very difficult to culture. মানে propagate করতে হবে, you can infect them but then you cannot propagate. So for laboratory diagnosis the easier method is go for a molecular diagnosis with the help of molecular methods. Now let us look at some of the RNA viruses. The pox viruses are DNA viruses. First is very common disease, almost everyone is, I hope, is vaccinated. This is called as measles. Now measles is basically is a disease of childhood. Most of the time the child would get infected. Next question comes, at what age? Generally the vaccination is given around 9 months because the child is protected after birth from the antibodies of the mother. After 6 months the antibody titers goes down and then the child gets infected. This is the time period when the child is vaccinated. Now measles obviously is a viral illness with rash, infection across to the respiratory route, the droplet infection, and it spreads from respiratory tract. Viremia happens. From viremia it lodges into various organs, especially the reticuloendothelial cells, lymph nodes, deeper organs including the liver, spleen, sometimes other organs also, and may disseminate even in all parts of the body including skin, respiratory tract, and even in conjunctiva. Now what can be the complications? If the skins are affected, they may get infected, secondary bacterial infection of skin lesions. If the pharynx is affected, pharyngitis can happen. If respiratory tract infection occurs, then secondary bacterial pneumonia can happen. So this manifests in the incubation period of 10 days, and it manifests in 3 phases. The first phase is the prodromal phase. That means in this phase the child has a febrile illness. Thereafter we have eruptive phase. That means after the febrile phase we have crops of eruptions all over the body. Generally it is seen, the first lesions may be seen in the oral region, also called as Koplik spot, thereafter throughout the body, and then we can find something called post-nasal phase. Okay, so this is an example of Koplik spot, where you can, if you open the mouth of the child, you can find these reddish erythematous lesions near the wisdom tooth of the child. Sorry, wisdom tooth, the molar tooth of the child. Thereafter, from the 10th day of the fever, Koplik spot appears in the 12th day. That is the mucosal spot. From the 14th day onwards, we can find similar eruptive lesions throughout the body. After this phase, that is after the viral episode, something happens. This is called as the stage of weight loss and weakness. Why? Because all the eruptions that happens, it affects the epithelial cells. Now most of the epithelial cells we can appreciate: the skin, the mucosa over the pharynx, the respiratory tract, and we can prevent the infection. But keep in mind, one more mucosal surface is also affected, that is the GI tract. And because the mucosal surface of the GI tract is affected, absorption of nutrient is affected during this 3-week period, and this may affect the growth of the child. The child may not gain weight, or may have a weight loss with lethargy, weakness. These can be seen. These are much more complicated, especially in the setting of protein energy malnutrition. I am not going into the depth of protein energy malnutrition. Okay. Now, what could be the complications? Secondary bacterial infections of the skin, pharynx, respiratory tract, that is secondary bacterial pneumonia, and diarrhea because of the affection of the GI tract. Late consequences can also be there. These viruses also affect the central nervous system. So after this febrile episode, there might be a phase of encephalitis. This is called as post-Measles encephalomyelitis. Sometimes long-term sequelae can also be seen. When the child becomes an adult, we can find clinical neurological manifestation. For example, in case of SSP or subacute sclerosing panencephalitis, the infection is ongoing within the central nervous system, and there we can also find the IgM in the CSF. So these are the long-term complications of the measles. Now coming to diagnosis, again, like most of the viral illnesses, this is diagnosed clinically. Laboratory confirmation can be done with the help of a nasopharyngeal swab with detection of antigen or the virus isolation. Again, this virus can produce a cytopathic effect and may form multinucleated giant cells. Now coming to treatment of measles, there are no antiviral drugs for therapy. So the treatment has to be supportive. What kind of supportive treatment you have to give? First is, the child has to be properly given proper nutrition and hydration. The child may dehydrate because of lack of water intake and also diarrhea. Next, the child may not gain weight or lose weight, so nutrition has to be monitored. Vitamin A supplementation has to be given. Vitamin A helps in re-epithelialization of mucosa and skin. This may prevent secondary bacterial infection and also diarrhea. And if secondary bacterial infection happens, that has to be promptly treated with antibiotics. Now coming to vaccine, again, measles is a vaccine preventable disease. Many strains are given, Swartz or Edmondson Zagreb strain that is more commonly given, and the vaccines are live vaccines prepared with the Chickenpox strain, and this is given commonly at 9 months of age. Nowadays, measles vaccine is combined with rubella and mumps vaccine. So, coming to that, now there is a WHO plan of elimination of measles and rubella. Hence, vaccination is mandatory for all cases. Target is of 95% vaccination. Now, coming to the next kind of disease, another manifestation which almost resembles measles is called as rubella or German measles. Now, this is caused by rubella virus, and now also keep in mind the last line. This virus is highly teratogenic. Teratogenic means, what do you mean by teratogenic? It can cause severe complication in the intrauterine fetus. That means if a pregnant woman is infected during pregnancy, there is a high chance of damage to the fetus. And if the child does survive, we call it as congenital rubella syndrome. This is the reason why vaccination of rubella virus is mandatory for all children, and especially in case of girls. And if any girl child has mixed this vaccine during childhood, she can be vaccinated before marriage, that means prior to conception. So if that happens, even if the mother gets infected, because of the preformed antibody, the child will be protected. Now, rubella virus is a toga virus, it is an RNA virus, and it can cause two types of infection. The most common infection is called as postnatal, that means after birth infection, and the other is called as before birth, that means congenital infection. So, what is postnatal infection? That means if a child after birth or any adult is affected, that is called as postnatal infection, maybe in childhood or maybe in the adulthood. So, like measles virus, it is acquired through the respiratory route, and thereby what happens is viremia. In that viremia, what we can also have is appearance of rash after 7 to 9 days. Incubation period is about 14 days, and if you look at this rash, a generalized erythematous rash can be seen all over the body. This also has other systemic complications, like it can affect various organs including the joints, leading to arthalgia or arthritis. It may also affect platelets, leading to thrombocytopenia, and like measles virus, it can also affect the central nervous system, causing encephalitis. Diagnosis is again generally clinical, but however, virus isolation, serology, and molecular test can be used for detection. Now, a very brief about congenital rubella syndrome. Now, actually, how the virus affects the child depends on in which stage of the pregnancy the mother acquires the infection. Suppose if the mother is affected very early in the conception, in the gestation, very early in the gestation, there might be total dysgenesis of the fetus, and there might be even miscarriage and abortion. Slightly later in the first trimester, various infections may occur, even gross damage to the child. Most commonly, what is seen in case of congenital rubella syndrome is a triad of deafness, blindness, and cardiac abnormalities. This is called as congenital rubella syndrome. Blindness is mainly because of cataract, and cardiac abnormality is mainly because of the patent ductus arteriosus. Many other cardiac abnormalities may also be there. Now, important part over here is the period of communicability. Again, if a pregnant woman is infected, this time period is very, very important for intervention. So, in case of rubella, it will be 1 week before appearance of rash to 1 week after appearance of rash. So, The date of appearance of rash is very, very important. Okay. Now, treatment of rubella, obviously there is no specific treatment. Most of the time, symptomatic treatment is given. The vaccine that is given is RA27/3 vaccine, and again it is given along with measles vaccine. Coming to the last part of the virus, something called as hand, foot and mouth disease. As the name suggests, the lesions will be seen in hand, foot and mouth. Very simple. This is usually characterized with ulceration of oral or pharyngeal mucosa and on the palmar and plantar area, along with fever and sore throat. Over you can see these are the eruptive ulcerative lesions on the fingers, on the soles and in the perioral region. Hence it is called as hand, foot and mouth disease. It is caused by a Coxsackie virus. আরও মনে রাখতে পারলে ভালো, কক্সাকি A16 ভাইরাস। কেন বলছি স্পেসিফিক্যালি, তোমাদের পিজি এন্ট্রান্সে এই কোশ্চেনটা জিজ্ঞেস করা। ওকে, সো ট্রান্সমিশন, most commonly children are affected. Secretion comes out from the mouth, so from one child to the other child, daycare center infection বেশি commonly হয়, and adults or caregivers they can get affected. Okay, so these are the various viral infections which has predominantly cutaneous manifestations. Other than this, many other viruses, for example, in case of dengue virus, we can find here, because of reduced platelet count, we can find PTG or purpura. Those are also cutaneous manifestations. Okay, so these are the viruses which has predominant cutaneous manifestation. Now moving on, we'll look at some of the parasites which cause cutaneous manifestation. Most of the parasitic infections are systematic. However, these are the list of the various parasitic infections which has cutaneous manifestation. First is Leishmaniasis. Leishmaniasis is a systemic disease. It affects internal organs of the body, but we also have cutaneous manifestations. Similarly, cutaneous MBBS. MBBS is predominantly present with intestinal or hepatic MBBS. But among the extraintestinal part manifestation, we can also find cutaneous MBBS. Similarly, Acanthamoeba, that is a free-living amoeba, more commonly associated with CNS infections, meningitis, encephalitis, or corneal ulcers. These are the common presentation. However, it may also cause cutaneous lesions. I'll just go through this very quickly. Cutaneous manifestation is called as cutaneous leishmaniasis, and sometimes it may also involve the mucus when it is called as mucocutaneous leishmaniasis. Again, it is divided into the old world and new world. Old world cutaneous leishmaniasis caused by a tropica complex. These are the lesions. This is called as the old world mane. Old world, new world কেন? বলতে পারবে? আরে এটা তো মেডিকেলে কিছু জিজ্ঞেস করে, হিস্ট্রি জিজ্ঞেস করেছে। ওয়ার্ল্ড ওয়ার তো রিসেন্টলি হয়েছে। ডিসকভারি অফ আমেরিকা। আমেরিকা ডিসকভার হওয়ার আগে কী ছিল? ইউরোপ, এশিয়া আর পার্টস অফ আফ্রিকা। These are the old world. When the new world was discovered, the America, ওরা দেখবে most of the Leishmania manifestation is the American manifestations. ঠিক আছে? So this is the old world manifestation, also called as the Oriental sword. যদি হিস্ট্রিতে পড়ে থাকো, Orient means India, Southeast Asia. These regions, China were called Oriental. So this is called as the Oriental sword. And sometimes these lesions, granulomatous lesions can be seen. This is called as Leishmaniasis recidivans. Gross diffuse cutaneous Leishmaniasis can also be seen. Diagnosis is on the same part of the Leishmaniasis. I'm not the depth. Coming to new world Leishmaniasis, নামগুলো দেখো, Mexicana, Braziliensis. So there we can find something called as Chickenpox ulcer, named down Mexican type. is the New World or Spanda, where there is gross destruction of the mucocutaneous regions. যেমন এখানে দেখতে পাচ্ছ নাকের কাছে the whole of the nasal septum has been eroded by the lesion. Okay. Treatment. Next comes cutaneous filariasis. Till now you have learned about filariasis. কে করে filariasis? Bankrupting. It is also called as Bancroftian filariasis. So what happens? The microfilaria remains in the blood, adult worm remains in the lymph node, and time to time microfilaria comes into the blood. Sometimes it may also come in other areas, like in case of loa, the disease is called loasis, or also called as African eyeworm. Over here microfilaria is released into the blood like that of Bancroftian filariasis. However, this microfilaria may come out in the ছবিটা আমাদের পড়া দেখাও মনে করি দেখি দেখেছো কেউ লোয়াসিসের ছবি এই ছবিটা দেখতে পাচ্ছ so what happens is basically the microfilaria roams in the subcutaneous tissue sometimes subcutaneous tissue থেকে conjunctiva চলে আসতে and we can see the microfilaria over here. This is called as loasis. ঠিক আছে আর একটা এখানে দেখতে পাচ্ছ সাবকিউটেনিয়াস টিস্যুর মধ্যে আছে এর সঙ্গে এই হচ্ছে তোমার লোয়াসিসের মাইক্রোফাইলেরিয়াটা এখন ডিফারেন্সেসগুলো পরে পড়বে আগে এটা দেখো আর একটা যেটা দেখার ইম্পর্টেন্ট ব্যাপার হচ্ছে এইটা যদি কম্পেয়ার করে দেখো এই সাইডে এখানে একটা সোয়েলিং দেখতে পাচ্ছ নিয়ার দ্য আইব্রাও দিস ইজ দ্য পেরিঅরবিটাল সোয়েলিং অলসো কল্ড অ্যাজ কালাবার সোয়েলিং তোমাদের ফার্মাকোলজি যদি ভালো করে পড়ো তাহলে তার সেখানে হিস্ট্রিটাও পাবে হিস্ট্রিটা হচ্ছে ফাইসোস্টিগমিনের নাম শুনেছো নিওস্টিগমিন ফাইসোস্টিগমিন কোথেকে পাওয়া যায় যে ওটা আবিষ্কার করেছিল তারই হচ্ছে ডিটেকশন হচ্ছে কালাবার সোয়েলিং একটা প্ল্যান্ট থেকে পাওয়া যায় তো কি প্ল্যান্ট এবার বলবো স্যার ফার্মাকোলজি কেন জিজ্ঞেস করছেন ওটা তো অন্য ডিপার্টমেন্টের ব্যাপার যারা ওখানে কাজ করতো ওয়ার্কার্স they used to have this filarial infection and this person নামটা তোমরা বসে বলবে he was an ophthalmologist he was experimenting with various drugs on eye and he observed that his servant the female person had swelling in the periorbital region ক্যালাবার আইল্যান্ডে কাজ হতো সেই জন্য নাম দেওয়া হয়েছিল ক্যালাবার সোয়েলিং বিরাট কিছু হাতি ঘোড়া না ঠিক আছে obviously diagnosis is almost similar to that of filariasis সব সময় যে চোখ থেকে পাওয়া যায় বা এভরি টাইম লোয়াসিস মানে চোখ থেকে বার করতে হবে সেরকম ব্যাপারটা না ব্যাপারটা ব্লাডেও পাওয়া যায় ঠিক আছে বাকি ডিটেকশন উইথ সেম অ্যাজ filariasis next is onchocerca valvularis this disease is more commonly seen in the African region and it causes something called as river blindness again the filarial worm it affects the eyes directly and there might be skin lesions also okay next comes this disease this is called as Dracunculiasis এইটা তোমাদের জিজ্ঞেস করা হতে পারে commonly called as Guinea worm disease causative agent is called as Dracunculis medianensis this disease was present in India আচ্ছা বেশ রাজস্থান কেউ গেছো ঘুরতে কেউ যাওনি রাজস্থান ঘুরতে রাজস্থানের আর্কিটেকচারের ব্যাপারে পড়েছো না সেটাও পড়ো না ভালো ভালো স্টেপ ওয়েল বোঝো কুয়ো গ্রাম বাংলার কুয়ো নয় যেটা হচ্ছে দড়ি দিয়ে জল টানে স্টেপ ওয়েল রানী কি ভাও নাম শুনেছো এগুলো তো জানা উচিত ইন্ডিয়ান ন্যাশনাল রানী কি ভাও হচ্ছে ইজ এ হিউজ স্টেপ ওয়েল অনেক নিচে জল থাকে সিঁড়ি দিয়ে নেমে গিয়ে জল তুলতে হয় তো বেসিক্যালি গিনি ওয়ার্ম ডিজিজটা কি একটা ফাইলেরিয়াল ওয়ার্ম থাকে যেটা সাইক্লপসের মধ্যে থাকে সাইক্লপস হচ্ছে জলের মধ্যে দেখবে অনেকটা এই সুঁয়োর মতো যেগুলো থাকে সেগুলোকে বলে সাইক্লপস। এদের ন্যাচারাল ইনফেকশন হয় ফিশ, সাইক্লপস এদের মধ্যে। এরা ন্যাচারাল ইনফেকশনের মধ্যে এদের যে লার্ভাটা হয় মেটাসার্কিয়াল লার্ভা, সেটা জলে লিবারেট করে। যখন কোনো হিউম্যান বিং জল তুলতে ওয়াটারের কন্ট্যাক্টে আসে তখন এই মেটাসার্কিয়াল লার্ভাটা স্কিনকে পেনিট্রেট করে দিয়ে বডির ভিতরে ঢুকে যায়, দিয়ে সেটা ম্যাচিওর করে, অ্যাডাল্ট ফিমেল ওয়ার্ম হয়, মেট করে, লার্ভা তৈরি হয়। তারপরে যখন লার্ভা বার করতে হয় তখন এই অ্যাডাল্ট ওয়ার্মটা পায়ের কাছে এসে এইখানে একটা ইরিটেটিভ লিজন তৈরি করে। ইরিটেটিভ লিজন হলে কী হবে, উপরের লিজনটা খুলে যাবে, আলসার হবে। তারপরে এই পার্সনটা যখন আবার সেই জলে যাবে, ওয়াটারের কন্ট্যাক্টে আসবে, তখন ফিমেল ওয়ার্মটা এই ওপেনিং থেকে বেরিয়ে লার্ভাটাকে রিলিজ করবে। বোঝা গেছে? তাহলে অ্যাডাল্ট ওয়ার্মটা কোথায় থাকে? হিউম্যান বডিতে। লার্ভাটা কোথায় থাকে? জলে। আবার সাইক্লপস, মাছ এদের মধ্যে মেটাসার্কিয়া হয়, আবার একজনকে ইনফেক্ট করে। ঠিক আছে? এইটা কীভাবে ডায়াগনোসিস করে সেটা দেখলে, এই ছবিটা দেখলেই বুঝতে পারবে। এই ছবিগুলো দেখো, এই লিজন অ্যাডাল্ট ওয়ার্ম ওয়াটারের কন্ট্যাক্টে মাথাটা বার করে বেরিয়েছে। One of the best method of treatment is to grab hold of the worm, স্লো ট্র্যাকশন দিয়ে পুরো ওয়ার্মটাকে বাইরে বার করা। যেমন এটা তো রিপ্রেজেন্টেটিভ ইমেজ, এইখানে এই ছবিটা যদি দেখো, এই ওয়ার্মটাকে দড়ি দিয়ে বেঁধে টেনে টেনে বার করা হচ্ছে। মনে হতে পারে যে কেন আমরা ওষুধ দিয়ে বার করতে, এটা সো গ্রস ব্যাপার। বেসিক্যালি হচ্ছে ওয়ার্মটা খুব কেয়ারফুলি বার করতে হয়, নাহলে ওয়ার্মটা যদি ছেড়ে যায়, ওয়ার্মের ভিতরে যে ইন্টারনাল কন্টেন্ট থাকে দোজ আর হাইলি অ্যালার্জেনিক, সিস্টেমিক অ্যানাফাইল্যাক্সিস হতে পারে। ঠিক আছে? এবার ইন্ডিয়া হ্যাজ অলমোস্ট ইরাডিকেটেড গুইনি ওয়ার্ম ডিজিজ, predominantly abolishing the use of staples and treating the patient. ন্যাশনাল প্রোগ্রাম অনেক দিন এই যে একটা ভালো পিকচার আছে, এই যে ওয়ার্মটাকে টেনে টেনে বার করা হচ্ছে। তো রাইট নাও ইন্ডিয়া হ্যাজ অলমোস্ট ইরাডিকেটেড গুইনি ওয়ার্ম ডিজিজ। আদার মেথডস হচ্ছে ওয়াটারের সাইক্লপসগুলোকে যদি মেরে ফেলি তাহলে ডেভেলপমেন্ট হবে না, সেই সাইক্লপস ট্রিটমেন্ট, ওয়াটার পিউরিফিকেশন ট্রিটমেন্ট। দিস ডিজিজ ওয়ার মোর প্রিডমিনেন্টলি ইন দ্য সেমি অ্যারিড অ্যান্ড অ্যারিড রিজনস ইন ইন্ডিয়া। সেই জন্য আমি বললাম রাজস্থান গেছো, এখানে তার মানে এই নয় যে শুধু রাজস্থানেই আছে, ভেরিয়াস পার্টস অফ মধ্যপ্রদেশ এইসব জায়গাতেও কিন্তু ডিজিজটা একসময় ছিল। কামিং টু ট্রিচিনোলোসিস, ইন্টেস্টাইনাল ইনফেকশনে পড়েছিলাম। ট্রিচিনোলোসিস is acquired when eating uncooked food. Now after acquiring the infection, this larva may move into the subcutaneous tissue and it will fail to complete its life cycle. So arrested development, this larva will die and will lead to muscular swelling. পেশেন্টের বডিতে বিভিন্ন জায়গায় মাস্কুলার সোয়েলিং পাওয়া যেতে পারে। হিস্টোপ্যাথোলজি করে ডায়াগনোসিস করা হয়। Last part of parasitic lesion is called as cutaneous larva migrans. Last class এ বলেছিলাম what is cutaneous larva migrans, something called as visceral larva migrans. Visceral মানে বডির ভিসারের মধ্যে দিয়ে যাচ্ছে। তাহলে all human hookworms when they enter through the cutaneous route, they travel to the subcutaneous tissue in the viscera of the body and completes its life cycle. এগুলোকে বলা হয় visceral larva migrans. Animal hookworms, they fail to complete the life cycle. Hence, when they move in the cutaneous area, their development is arrested and there is inflammatory reaction. এই inflammatory reaction এর জন্য একটা serpinges means snake like lesions on the skin হয়, সেটাকে বলা হয় cutaneous larva migrans. Okay. Now coming to the last part of today's discussion is fungal infection of skin and soft tissue. Now fungal infections can be divided again, যেটা introduction to fungal infections এ বলা হয়েছে, it is superficial mycosis, subcutaneous mycosis and opportunistic mycosis. Superficial mycosis এর মধ্যে most common type is called Tinea versicolor. Tinea means worm, versi means multiple, versatile, color means color. This is caused by a fungus called as Malassezia furfur. It's a yeast-like fungus, yeast fungus. Why versicolor? Because it may cause pigmentation. Hypopigmentation होते पारे, hyperpigmentation होते पारे. Hence it is called as versicolor. নানা রকম pigmentation होते पारे. It affects the superficial layer of the skin. Commonly presentation এরকম diffuse lesions, but they are non-inflammatory and non-pruritic. Why non-inflammatory and non-pruritic? Because they affect the dead cells. ঠিক আছে? Generally it is seen in the trunk region. Another lesion is called as seborrheic dermatitis, যেটা commonly লোকে কি বলে থাকে, মাথায় হলে কি বলে লোকে, dandruff, caused by Malassezia furfur. This is called as seborrheic dermatitis. Seborrheic means seborrhea. রিয়া মানে কি? সিক্রিশন. সেবো মানে সিবাম সিক্রিশন, মানে অয়েলি সিক্রিশন. Malassezia furfur is a লিপিড লাভিং অর্গানিজম. ঠিক আছে? অনেকে ওই জন্য দেখবে মাথায় প্রচুর তেল দেয়, নারকেল তেল, এই তেল ওই তেল, ওটা স্ক্যাল্পে রয়ে যায়, সেই জন্য Malassezia ইনফেকশন বেশি কমন হয়. ঠিক আছে? কি হবে? ডার্মাটাইটিস হবে, ইনফ্লামেশন হবে, সেবাসিয়াস গ্ল্যান্ডের মাথাগুলো ব্লকড হয়ে যাবে, সিক্রিশন জমা হবে, সেটা সেকেন্ডারি ব্যাকটেরিয়ালি ইনফেক্টেড হতে পারে, যেটা দেখতে পাবো. এবার যদি আমরা মাইক্রোস্কোপি করে দেখি, লিজন থেকে স্ক্রেপ করে মাইক্রোস্কোপি করে দেখি, এটাকে বলা হয় স্প্যাগেটি অ্যান্ড মিট বল অ্যাপিয়ারেন্স. কতজন জানো স্প্যাগেটি কী জিনিস? স্প্যাগেটি ইজ এ টাইপ অফ নুডলস, আর মিট বলস মানে হচ্ছে বেসিক্যালি বল. তো এখানে যদি দেখো ইস্টের শেপটা কয়েকটা হচ্ছে নুডলসের মতো রড শেপের, আর কিছু কিছু হচ্ছে সার্কুলার বল লাইক স্ট্রাকচার. এটাকে বলা হয় স্প্যাগেটি অ্যান্ড মিট বল অ্যাপিয়ারেন্স. কালচার করা যেতে পারে, উড ল্যাম্পস করা যেতে পারে, পারলে ইমেজ দেখে নিতে পারে. যদি উড ল্যাম্পসে দেখি আমরা অল্টার্ড কালার দেখতে পাই, ব্লুইশ গ্রিন কালার দেখতে পাওয়া যায়. আনাদার টাইপ ইজ কল্ড অ্যাজ টিনিয়া নাইগ্রা. টিনিয়া মানে হচ্ছে ওয়ার্ম লাইক, নাইগ্রা মিনস ব্ল্যাক. This is caused by a fungus called Hortia workani, black fungus. Next is called piedra. এটা হোয়াইট পিয়েড্রা হতে পারে, ব্ল্যাক পিয়েড্রা হতে পারে. So what this piedra is? This is a fungal infection of the hair, commonly seen in the moist area. Moist area মানে armpits and groin, যেখানে হেয়ারও আছে and humid environment to maintain. So what happens basically, the hair follicles are affected either on the inside or on the outside. যদি ইনসাইড হয় এন্ডোথ্রিক্স, বাইরে হলে এক্টোথ্রিক্স. কামিং টু দ্য লোয়ার লেভেল মানে নট অন দ্য ডেড সেলস, দ্যাট ইজ ডার্মাটোফাইটোসিস, যেটা আগের দিন পড়েছিলাম. প্রিডমিনেন্টলি 3 টাইপ: ট্রাইকোফাইটন, মাইক্রোস্পোরাম, এপিডার্মোফাইটন. এই লিজেন্সগুলো আগের দিন বলেছিলাম, ডিপেন্ডিং অন দ্য টাইপ অফ দ্য এরিয়া. আজকে তোমরা বলো, মাথায় যদি হয় ক্যাপাইটিস, বডিতে হলে কর্পোডিস, পায়ে হলে পেডিস, হাতে হলে ম্যানাম, ইঙ্গুইনাল রিজনে হলে ক্রুডিস, বিয়ার্ডেড এরিয়াতে হলে বারবি, ফেসে হলে ফেসি. এই যে এটা মাথায় ক্যাপাইটিস, এটা কি পেডিস, পায়ে, পায়ে দুটো আঙুলের মাঝে হয়েছে, এটা হচ্ছে তোমার ফেসি, এটা হচ্ছে কর্পোডিস. এরকম টিপিক্যাল সার্কুলার লিজন উইথ সেন্ট্রাল ক্লিয়ারিং. দিস ইজ ডার্মাটোফাইটস. কীভাবে ডায়াগনোসিস করবে? স্কিন স্ক্র্যাপিং নিতে হবে, কেওএইচ করে আমরা দেখতে পাবো. কেওএইচে আমরা কি দেখি? হাইফি দেখি, কালচার করা যেতে পারে. কালচার করে বেস্ট অন দ্য টাইপ অফ দ্য তোমার এই স্পোরগুলো কীরকম বেরোচ্ছে সেটাকে আমরা ক্লাসিফাই করি, কোনটা ট্রাইকোফাইটন, কোনটা এপিডার্মোফাইটন, মাইক্রোস্পোরাম, এপিডার্মোফাইটন. ওকে, কালচারে এইরকম দেখতে হয়, বিভিন্ন কালার. জাস্ট দেখানোর জন্য দেখছি, তোমাদের এগুলো লাগবে, কিন্তু কালচার করা যায়. ঠিক আছে? আর একটা কথা বলে দিচ্ছে, Dermatophytes are commonly treated with topical antifungal agents. In case where topical therapy is not effective, systemic antifungals are also given. Nowadays, resistance to antifungals are also seen. This is the reason why culture is also required. Culture করলে আমরা antifungal susceptibility টেস্টিংটা করতে পারি। ওকে, যে কেউ হয়েছে বললাম স্পোরগুলো কোনটা কীরকম সেটার উপর ডিফারেন্সিয়েট করা হয়। ওকে, সুপারফিশিয়াল স্কিন ইনফেকশনের মধ্যে প্রিডমিনেন্টলি কী কী হলো? ফার্স্ট হচ্ছে কমনলি টিনিয়া ভার্সিকুলার caused by Malassezia furfur. Next important is seborrheic dermatitis caused by Tinea versicolor. Next important is Tinea nigra. পরেগুলো মনে রাখতে পারলে ভালো, না মনে রাখতে পারলে ঠিক আছে, বাট মোস্ট ইম্পর্টেন্ট ইজ dermatophytes. Dermatophytes caused by three fungus কি কি? Epidermophyton, Trichophyton আর Microsporidium. Coming to subcutaneous mycos, most important is called as mycetoma, also called as Madura foot. This disease was first named by or named after an Indian city of southern India called as Madurai. So what basically happens is, এই ছবিটা যদি দেখো, the patient starts to complain of swelling of the foot and discharging sinuses. The patient comes in complaint with swelling, discharging sinuses and presence of granules in the discharge, মানে দানা বেরোচ্ছে. So these granules can be caused by two types of organisms. Either it could be a fungus or it could be a bacteria. If it is caused by fungus, we call it as eumycetoma, মানে true fungus. ঠিক আছে? If it is caused by bacteria, it will be named either actinomycetoma or botromycosis. Actinomycetoma কেন বলে? It is caused by a bacteria called actinomycetes. Botromycosis বলা হয় তার কারণ it is caused by Staphylococcus aureus. এই জিনিসটা মাথায় রাখো। তাহলে pain, swelling of foot, discharging sinuses and presence of granules, এই জিনিসটা যদি থাকে, you will have three differential diagnosis: eumycetoma, actinomycetoma or botromycosis. ঠিক আছে? এবার ডায়াগনোসিস কীভাবে করবে? In all cases, discharging sinusকে we can collect the granules. These granules are nothing but aggregation of microorganisms. যদি ফাঙ্গাস হয় ফাঙ্গাল অ্যাগ্রিগেটস, ব্যাকটেরিয়া হলে ব্যাকটেরিয়াল অ্যাগ্রিগেটস। ঠিক আছে? তাহলে এই গ্র্যানিউলসটাকে যদি আমি মাইক্রোস্কোপিতে দেখি বা কালচার করি, উই ক্যান ফাইন্ড দ্য পজিটিভ অর্গানিজম। পেন অ্যান্ড সোয়েলিং কেন হচ্ছে? বিকজ অফ এ ইমিউন রিয়াকশন। তাহলে ইনসিশন অ্যান্ড ড্রেনেজ হ্যাজ টু বি গিভেন অ্যান্ড বেসড অন দ্য অর্গানিজম উই হ্যাভ টু ইনিশিয়েট ট্রিটমেন্ট। কীরকম? If it is fungus, মানে eumycetoma যদি হয়, we have to give antifungals. If it is actinomycetoma, we have to give a particular set of antibacterials. Staphylococcus হলে anti-staphylococcal antibiotics দিতে। বোঝা গেছে? This is the reason why diagnosis is very very important. Just pain and swelling মানে এটা ফাঙ্গাল, এটা নয়। ওকে, আচ্ছা, এই যে গ্র্যানিউলসগুলো বলছিলাম, গ্র্যানিউলসগুলো অনেক রকম কালার হয়। যদি হোয়াইট টু ইয়েলো ইন কালার হয়, it is commonly caused by the actinomycetes group of bacteria, Nocardia by actinomycetes. Black and white granules are more commonly seen with fungus. সেখান থেকে একটা ইন্ডিকেশন পাওয়া যেতে পারে, বাট কিপ ইন মাইন্ড দিস লিশন ইজ ভেরি ভেরি ডিস্ট্রাকটিভ. It starts with a subcutaneous infection, but it destroys muscles, fascia, bone, tendons, everything. So early detection and control of the infection is very very important. প্রত্যেকটা আলাদা করে বলার দরকার নেই। And if you ever think that deep tissue may be affected, always do a X-ray of the wound at least. You may also have to do a CT scan. Deep bone infection হলে CT scan ও করতে হতে পারে to find out the extent of the disease. Okay, How does this infection occur? Very simple. It is commonly traumatic, that is direct inoculation. ফাঙ্গাস হোক ব্যাকটেরিয়া হোক ডাইরেক্ট ইনোকুলেশনের পরে ইনোকুলেটেড হয়ে যায়, লোকাল অ্যাবসেস তৈরি হয়, দেন ইট স্টার্টস টু স্প্রেড। তাহলে হোয়াট আর দ্য ক্লিনিক্যাল ট্রায়াড? সোয়েলিং, ডিসচার্জিং সাইনাস অ্যান্ড প্রেজেন্স অফ গ্র্যানিউলস। তাহলে হচ্ছে মাইসিটোমা। Histopathological diagnosis can also be done. Next coming, this is called as sporotrichosis. Sporotrichosisটা এইভাবে মনে রাখবে। This is called as rose gardener's disease. এটা কীরকমভাবে হয়? একটা ফাঙ্গাস থাকে যেটা জেনারেলি গাছে থাকে, ঠিক আছে? যে ফার্মার বা যে গার্ডেনটাকে টেন্ড করছে খালি হাতে অ্যাটেন্ড করছে। ওয়াই রোজ? রোজে থাকে কাঁটা, কাঁটা যখনই ফুটছে ফাঙ্গাসটা ইনোকুলেটেড হয়ে যাচ্ছে। এই ফাঙ্গাসটা নাও ইট উইল স্প্রেড অ্যালং দ্য লিমফ্যাটিক্স ইন্টু দ্য লোকাল রিজনাল লিম্ফ। যতক্ষণ লিমফ্যাটিক দিয়ে স্প্রেড করবে লিমফ্যাঞ্জাইটিস হবে। আগের দিন ছবি দেখেছিলাম মনে হয়, যেটা কিউটেনিয়াস পুরো লিমফ্যাঞ্জাইটিস, রেডিশ ডিসকালারেশন টিল দ্য লিম্ফ নোড, সেটা হবে। অ্যালং দ্য ট্র্যাক দেয়ার উইল বি ড্রেনিং সাইনাসিস, মানে যেখান দিয়ে লিমফ্যাটিকটা যাবে সেখানে সেখানে ড্রেনিং সাইনাস। দিস ইজ কল্ড অ্যাজ স্পোরোট্রাইকোসিস। এই যে এই ছবিটা যদি দেখো, প্রিক হয়েছে পায়ে, কিন্তু অ্যালং দ্য লিমফ্যাটিক্স ইনগুইনাল লিম্ফ নোড অব্দি ফাঙ্গাসটা স্প্রেড করেছে। থ্রু আউট দ্য ট্র্যাক, এই যে লিমফ্যাটিক ট্র্যাকটা আছে, প্রথমে লিমফ্যাঞ্জাইটিস হবে, তারপরে এরকম আলসারেটিভ লিশনস হবে। সিমিলারলি এই ছবিটা যদি দেখো, হাতে থাম্বে পিন প্রিক হয়েছে, অ্যালং উইথ দ্যাট অ্যালং দ্য লিমফ্যাটিক ট্র্যাক এটা হয়। দিস ইজ কল্ড অ্যাজ sporotrichosis. This is caused by sporotrich shingles. Now, this infection is not restricted only to the skin and lymphatics. Osteoarticular, pulmonary and disseminated infection can also occur. Achha. Diagnosis can, Sporotrich is a dimorphic fungi. Dimorphic fungi diagnosis এ বলেছিলাম আমরা 25 and 37 degree centigrade রাখি and yeast to mold form এ কনফার্ম করা। Biopsy বা histopathology you can find something like this. This is called as asteroid body. Almost similar to this infection arekta hoy, this is called as chromoblastomycosis. এইগুলো তোমাদের অত পরীক্ষার পয়েন্ট অফ ভিউতে লাগবে না, কিন্তু দেখিয়ে রাখছি পরবর্তীকালে যে ভুলগুলো হয় সেগুলো আমি বলার জন্য দেখিয়ে রাখছি। এই যে এই ছবিটা দেখো, বেসিক্যালি ক্রোমোব্লাস্টোমাইকোসিস ইজ কজড বাই ব্ল্যাক ফাঙ্গাস। ঠিক আছে, কোথায় থাকে? সয়েলে থাকে, গাছে থাকে, এইসব জায়গায় থাকে। কারা অ্যাফেক্টেড হয়? যারা এইসব নিয়ে কাজ কারবার করে, মানে ফার্মার্স, অ্যানিমাল হ্যান্ডলার্স, এরা অ্যাফেক্টেড হয়। কোথায় অ্যাফেক্টেড হবে? যেগুলো এক্সপোজ পার্ট অফ দ্য বডি, হাতে আর পায়ে। কীভাবে ইনফেকশানটা হয়? ডাইরেক্ট ইনোকুলেশন। মাইনার ট্রমা ইনজুরিতে ডাইরেক্ট ইনোকুলেশন হয়, ফাঙ্গাস রয়ে যায় এবং সেই ফাঙ্গাসটা ধীরে ধীরে স্প্রেড করে। পেন হবে, সোয়েলিং হবে, ডিসচার্জিং সাইনাসিস হবে। ঠিক আছে, মেনি আ টাইম দিস আর নন হিলিংস। ফার্স্ট থিং তোমাদের মাথায় আসবে, এটা একটা নন হিলিং আলসার। ইউ স্টার্ট treating the patient with various types of antibiotics. When the patient does not has no healing, you think of malignancy and other causes. সেই জন্যই দেখানো, আর কিছু না। Nobody expects কি তোমরা ক্রোমোব্লাস্টোমাইকোসিস ডায়াগনোসিস করবে, বাট কিপ আ ফাঙ্গাল ডিজিজ ইন ইউর মাইন্ড। যদি এরকম ডিজিজ পাও, কিপ দ্য ডিফারেন্সিয়াল ডায়াগনোসিস, ইট কুড বি আ ফাঙ্গাল ডিজিজ। ঠিক আছে, ডায়াগনোসিস ইজ নট ভেরি ডিফিকাল্ট। এই যে লিজনসগুলো আছে, ইউ ক্যান এক্সাইজ দ্য লিজন অ্যান্ড সেন্ড ইট ফর হিস্টোপ্যাথোলজি অ্যান্ড মাইক্রোবায়োলজিক্যাল অ্যানালিসিস। ইট উইল গিভ আ কনফার্ম ডায়াগনোসিস। ঠিক আছে, এটা আমি এই জন্য বলছি কারণ প্র্যাকটিক্যালি আই হ্যাভ সিন আ কেস ইন হুইচ এরকম নন হিলিং আলসার্স ছিল, অ্যান্ড দ্য পেশেন্ট ওয়াজ ইনডিড সেন্ট ফর বায়োপসি বিকজ people suspected it could be a cutaneous malignancy. But prior to biopsy, we opted for just a plain incision and punch biopsy. There we found out ইট ওয়াজ ক্রোমোব্লাস্টোমাইকোসিস। জাস্ট এইটুকুই তোমাদের বলা, ঠিক আছে? খুব বেশি ডেপথ ইজ নট এক্সপেক্টেড অফ ইউ। এই জিনিসটা মাথায় রাখবে শুধু, স্ক্লেরোটিক বডি অনেক সময় পিজি এন্ট্রান্সে কোশ্চেনে জিজ্ঞেস করে যে ডায়াগনস্টিক মোড কি, ইট ইজ দ্য ফাইন্ডিং দ্য স্ক্লেরোটিক বডি, ঠিক আছে? আর দিজ আর সাম অফ দ্য নেমস অফ ফাঙ্গাস। উচ্চারণ করতে পারলে ভালো, না করতে পারলে আরও ভালো। শুধু এইটুকু মনে রাখো, ক্রোমোব্লাস্টোমাইকোসিস। ওকে, এই যে স্ক্লেরোটিক বডি, ছবিটা দেখে দাও। নেক্সট আরেকটা ফাঙ্গাস বলে দিচ্ছি, এটাও ইন্ডিয়াতে ভেরি কমন, স্পেশালি ইন দ্য রুরাল পপুলেশন। তোমরা যদি পড়ে থাকো ইয়ার নোজ থ্রোটে, ভেরি কমন ম্যানিফেস্টেশন ইজ এ নেজাল পলিপ, ঠিক আছে? বাট দিস ইজ নট আ পলিপ। দেখে মনে হচ্ছে একটা রেডিশ কালার সোয়েলিং যেটা নাক থেকে বেরিয়ে আসছে, বাট দিস ইজ নট আ পলিপ। দিস ইজ আ ফাঙ্গাল ইনফেকশন অফ রাইনোস্পোরিডিয়াম সিভেরি, ফাঙ্গাসটার নাম। দিস ইজ কল্ড অ্যাজ রাইনোস্পোরিডিয়াসিস। ইট মে অ্যাফেক্ট nasal and oral mucosa, both nasal and both even oral mucosa. এইবার ছবিটা দেখে যে এইবার হচ্ছে জিনিসটা কি হয়, ইট রিজেম্বলস লার্জ ফ্রায়াবল পলিপস। মনে রাখবে এই ওয়ার্ডটা, ফ্রায়াবল। ফ্রায়াবল মিন্স, হোয়াট ইজ ফ্রায়াবল? ইংরেজিও জানো নাকি? ফ্রায়াবল মানে কি? ভেঙে যেতে পারে। তাহলে পলিপ ভেবে যদি ওটা খোঁচাখুচি করো, ভেঙে যাবে, প্রফিউজলি ব্লিড করবে, সেই ব্লিডিং কন্ট্রোল করতে পারবে, ঠিক আছে? ওই জন্য আউটডোরে বা চেম্বারে বসে যদি এরকম পলিপ দেখো, এরকম কিছু দেখতে পারো, আর যাই করো বা না করো, কোনোদিন পোক করবে না। নট ইভেন উইথ এ বার্ড, যেটা কটন বার্ড। মনে হতেই পারে যে কটন বার্ড দিয়ে করলে কী হবে, দে আর হাইলি ফ্রায়াবল। শার্প ইনস্ট্রুমেন্টও লাগে না, ব্লান্ট ইনস্ট্রুমেন্টও কিন্তু ভেঙে যেতে পারে, ঠিক আছে? নেভার পোক ইন দিস থিংস। আচ্ছা, এটা একটা প্রস্টিটিউয়েন্ট প্যারাসাইট, থাকে কোথায়? জলে। হোয়াট টাইপ অফ ওয়াটার? স্ট্যাগনেন্ট ওয়াটার। কোন টাইপ অফ স্ট্যাগনেন্ট ওয়াটার? তা বলে কি সুইমিং পুলে পাবেন? না, পুকুরে। কেন? এটা জেনারেলি অ্যাসোসিয়েটেড উইথ অ্যানিমালস। তাহলে যেসব পুকুরে দেখবে লোকে গরুকে চান করাচ্ছে, মোষকে চান করাচ্ছে, ছাগলকে চান করাচ্ছে, সেই পুকুরে সে নিজেও ডুব দিচ্ছে। যখনই ডুব দিচ্ছে তখন কি ওরাল আর নেজাল ক্যাভিটিতে ওই পন্ড ওয়াটারটা যাচ্ছে, ডাইরেক্ট ইনোকুলেশন হচ্ছে, সেখানে আস্তে আস্তে ফাঙ্গাল গ্রোথ হচ্ছে। যেটা ছবিতে দেখলে, দ্যাট ইজ নট পলিপ, দ্যাট ইজ দ্য ফাঙ্গাল গ্রোথ অফ দ্য মিউকোসা, ঠিক আছে? ট্রিটমেন্ট কী হচ্ছে? বায়োপসি করে এরকম লিজন থাকে, এগুলো যেটা দেখতে পাচ্ছ বড় বড় হচ্ছে স্পোরাঞ্জিয়া। ট্রিটমেন্ট হচ্ছে হয় মেডিকেল ট্রিটমেন্ট, ছোটো থাকলে ড্যাপসন দিয়ে দিতে পারে, আর যদি সাইজ বড় হয় তখন অবভিয়াসলি ইএনটি সার্জনকে রেফার করে সার্জারি করাতে হবে, এছাড়া কোনো অপশান নেই। Last but not the least, in case of opportunistic infection, I have already told you, opportunistic fungal infections also has cutaneous manifestation, from penicillium bacteromyces to candida, candida mucosal হতে পারে, regional candidiasis হতে পারে, onychomycosis হতে পারে, বা esophageal candidiasis হতে পারে, cryptococcosis হতে পারে, aspergillosis হতে পারে, বা mucormycosis। প্রত্যেকটার কিন্তু cutaneous manifestation হতে পারে, ঠিক আছে? So that was all about skin and soft tissue infections. I hope you have some idea, ঠিক আছে? Most of the organisms that we have covered in these things, you will also read about these organisms also in other types of infections, ঠিক আছে? So যেটা আমি বারবার বলছি, you have to go through system wise and also organism wise, ঠিক আছে? তো যখনই পড়বে, read about the various differential diagnosis,